Good afternoon, everyone. On behalf of MGM Children's, which is the pediatric wing of MGM Healthcare Chennai, I take pleasure in welcoming you all for this discussion. So, MGM Children's, to begin with, is the Department of Paediatrics and Neonatology, which is a part of MGM Healthcare Hospital situated in Aminjikarai in Chennai. So, we offer varied services to children ranging from the day of birth until 18 years of age, which includes pediatric outpatient department, pediatric emergency services, pediatric intensive care unit, and all subspecialties which deal with children, including pediatric neurology, hematology, oncology, nephrology, and all other services that you can think of. So we have a comprehensive pediatric care that is being offered here. So I'll be switching between bilingually between English and Tamil to benefit the varied audience that we'd be catering to. Just to begin with, as an introduction, I'm Dr. Arvind. I'm one of the consultant pediatricians in MGM Children's, and I usually deal with pediatric outpatients, pediatric emergency services, and pediatric intensive care. And I had my training in northern India in Chandigarh, and then to some extent in the United Kingdom as well. And I practice here in MGM Children's. So here we are today, basically to address the challenge of COVID pandemic that we are all going through in this current situation. நீங்க எல்லாருமே நியூஸ்ல பார்த்துட்டு தான் இருப்பீங்க. கோவிட் சுச்சுவேஷன் ஆல்மோஸ்ட் டெய்லி பேசிஸில் நியூஸ் பேப்பர்ஸ்லையும் நம்மளுடைய டிவி சேனல்ஸ்லையும் டெய்லி பேசிஸில் நம்ம பார்த்துட்டே தான் இருக்கோம். அண்ட் அஃப்கோர்ஸ் நம்ம ஃபேமிலியில் யாராவது ஒருத்தர் கோவிட்னால அஃபெக்ட் ஆனாக்கா நமக்கு இருக்கக்கூடிய பயம், அந்த பதட்டம், இதெல்லாம் வந்து நம்ம நிறைய பேர் நம்ம ஃபீல் பண்ணியிருப்போம். இல்லை பக்கத்து வீட்டில் இல்லை தெரிஞ்சவங்க வீட்டில் நம்ம பார்த்து தான் இருப்போம். இது வந்து குழந்தைங்களை அஃபெக்ட் பண்ணும்போது இன்னுமே இந்த கவலை அதிகமாக இருக்குன்றதை நம்ம எல்லாராலையும் புரிஞ்சுக்க முடியுது. அதை நம்ம ஏற்றுக்கிட்டு தான் ஆகணும். ஸோ ஒரு குழந்தை வந்து ஒரு ஃபேமிலியில் அஃபெக்ட் ஆகிருக்கும்போது அந்த ஹோல் ஃபேமிலியோட டைனமிக்ஸே வந்து கண்டிப்பாக அஃபெக்ட் ஆகுன்றது எல்லாருக்குமே ஒரு தெரிஞ்ச ஒரு விஷயம்தான். ஸோ நம்ம எப்படி இதை எதிர்கொள்றது, நம்ம இதை வந்து எப்படி இந்த சுச்சுவேஷனை சமாளிக்கிறது, ஏன்னா இது வந்து எப்போ முடியுன்றது உலகத்தில் இருக்கக்கூடிய எந்த ஒரு வல்லுநர்களாலையும் கரெக்டாக கணிக்க முடியலை இன்னமும். ஸோ அந்த ஒரு நிலைமையில நம்ம குழந்தைகள் வந்து பாதிக்கப்படும் போது நம்ம எப்படி இந்த சுச்சுவேஷனை எதிர்கொள்றது, இதுக்கு நம்ம என்ன மாதிரிலாம் தயாராக இருக்கலாம், எந்த மாதிரி முன்னெச்சரிக்கை நடவடிக்கைகள் நம்மளால் எடுக்க முடியும் அப்படின்ற விஷயங்களை வந்து நம்ம இங்கே பார்க்கறதுக்காக தான் நம்ம இந்த டிஸ்கஷன் வந்து நம்ம பண்ண போகிறோம். ஸோ இட்ஸ் primarily to address the basic questions that people might have in terms of taking care of their children who might be affected by COVID infection in this current pandemic. That we have here a panel of experts who would be discussing with you about certain basics of COVID disease in children. We hope it's really helpful and useful to attend to the major concerns that you would all have. To begin with, I'll start with introducing our distinguished panelists. To my extreme right, we have Professor Dr. Binu Ninan. So he's the head of the Department of Paediatrics and Neonatology. Just to give you some background, neonatology refers to the field of pediatrics that deals with children from the day of birth until about 4 weeks or 1 month of age. So they are further specialized pediatricians who deal with the small babies who are just newborns. So Dr. Binu is basically an expert in that field. He has more than 30 years of distinguished experience in pediatrics and neonatology, and he has had his training and work experience in the United Kingdom and Australia. He also has the great privilege of having established one of the best and biggest neonatal centers in India, especially in Tamil Nadu, in Chennai as well. So we are glad to have you, sir, in our discussion today. And sitting next to me is senior consultant pediatrician, Dr. Deepa Easow. She has had a training from the famous Institute of Child Health, Egmore, here in Chennai. And she also has her vast experience, which has spanned beyond 15 years of her practice. So she has encountered a lot of pediatric outpatients and critical and other common illnesses that children do face. And she has been a guide to so many parents who would come looking for care for their children. And to my left, I have a senior consultant pediatrician who takes care of pediatric emergency services in MGM Children. That's Dr. Nisha M. George. So she was trained in the distinguished Christian Medical College, Vellore, and she has had a vast experience dealing with children, especially those presenting to the emergency department, which is usually a high intense area. And she has had an experience that has spanned about 15 years once again. And we are very glad to have her here because We do have lots of children presenting to the emergency department with COVID and its related manifestations. So it'll be interesting to hear her experience in this as well. And sitting next to her, we have another one of the senior most consultants in our team, Dr. Anitha VP. So she also has about 25 years of experience in her pediatrics, and her main area of interest is pediatric intensive care. She had her training in Institute of Child Health, Egmore, followed by Apollo Hospitals as well. And she has more than 25 years of experience dealing with children admitted to the critical intensive care unit. So especially when children with COVID or other pathologies have problems that make them require critical care, that is ventilation or other sophisticated care, we need specialists who are very well experienced in dealing with this. So in that manner, we are very glad to have Dr. Anitha as well here to address certain questions about children who are admitted in intensive care. ஸோ தமிழில் நான் ரொம்ப சுருக்கமாக நான் சொல்லி முடிக்க விரும்புகிறேன். நமக்கு டாக்டர் பினு நைனான் இருக்கார். அவர் எங்களுடைய டிபார்ட்மெண்ட்டோடைய தலைமை மருத்துவர், குழந்தைகள் நல மருத்துவர். ஸோ அவருக்கு 30 வருஷத்துக்கு மேலான எக்ஸ்பீரியன்ஸ் இருக்குது குழந்தைங்களோட டீல் பண்ணுறதுல. டாக்டர் தீபா இஷோ, அவங்களும் 18 வருஷத்துக்கு மேலான எக்ஸ்பீரியன்ஸ் இருக்கக்கூடிய ஒரு குழந்தைகள் நல மருத்துவர், சென்னையில் ப்ராக்டிஸ் பண்ணிட்டு இருக்காங்க. அண்ட் எனக்கு பக்கத்தில் இடது பக்கத்தில் உட்காந்துருக்கக்கூடிய டாக்டர் நிஷா, அவங்களும் வந்து 15 வருஷத்துக்கு மேலான எக்ஸ்பீரியன்ஸ் பீடியாட்ரிக் எமர்ஜென்சி டிபார்ட்மெண்ட்டில் இருக்கக்கூடியவங்க. அண்ட் டாக்டர் அனிதா விபி எனக்கு லெஃப்ட் சைடில் கடைசியில் உட்காந்துருக்கக்கூடியவங்க. ஒரு குழந்தைகள் நல மருத்துவத்தில் தீவிர சிகிச்சை பகுதியில் அவங்களோட ஸ்பெஷாலிட்டி இருக்குது. ஸோ நம்ம இந்த நெக்ஸ்ட்டு ஒரு ½ hour 45 minutesல குழந்தைகளுக்கு வரக்கூடிய பிரச்சனைகள், இந்த கோவிட் சம்மந்தப்பட்ட பிரச்சனைகள் என்னென்ன வருது, அதை எப்படி நம்ம எதிர்கொள்கிறது, எப்படி கண்டறியறது, எப்போ ஹாஸ்பிட்டலுக்கு நம்ம கரெக்டாக போகிறது, என்ன மாதிரி விஷயங்களை நம்ம எதிர்பார்க்கலாம், அவங்க எப்படி வந்து ஜென்ரலாக ரெஸ்பாண்ட் பண்ணுறாங்க ட்ரீட்மெண்ட்டுக்கெலாம், இந்த விஷயங்களை நம்ம கேட்டு தெரிஞ்சுக்கலாம். And I'm also excited as you're all to gain more knowledge about how these kids perform. So to begin with, I'll address my question to Professor Dr. Binu Ninan. Usually childbirth is supposed to be a beautiful and memorable process for all families. But in this era of COVID pandemic, I think an unprecedented fear has struck almost the entire public. So this is all the more true, especially when a pregnant woman gets this COVID infection. The worry for the woman more than herself is about what happens to my baby. So of course, it's a great anxiety to both the pregnant mother as well as the entire family. So, sir, I would like to know from you, like, how does this infection to the mother affect the baby? What should the family expect at or after birth of such a baby? Can the mother actually stay with this baby, because they are always saying that you stay away from each other to avoid spread of the infection? And can the mother actually breastfeed this baby, because that is again one of the most essential components of a newborn baby? But in this situation, can a mother actually breastfeed? Is it really safe? How do they deal with this, sir? Can I have your input on that, please?
So, good afternoon, everybody. And thank you, Aravind, for that nice introduction and all the questions that you have put to me. Now, the question that you asked me about the pregnancy and the immediate neonatal period is a question that comes irrespective of whether there is COVID or not. What happens to pregnancy? What happens to the newborn baby? And what are the problems that can be dealt with? Now, to put it in perspective, there are 3 or 4 issues that we need to know about, which I often discuss with parents. One is pregnancy loss. Second is prematurity. The third one is called the asphyxia, or the baby crying at birth. And the fourth is called malformations or abnormalities in the baby. These are the 4 major areas that we often talk about. So let me go through it one by one in the context of COVID. First of all, pregnancy loss. I don't know if all of you are aware that of all the pregnancies, around 10% of the pregnancies, that is out of 100, around 10 of them, there would be a pregnancy loss. Now, as far as COVID is concerned, the concern that the world community was looking at was, would COVID infection increase the number of pregnancy losses? So the question is whether the pregnancy loss would be more if there is a COVID infection going on. The good news is that no, COVID infection does not increase the pregnancy loss. The second question is that when the baby is inside mommy's womb, would an infection increase the amount of malformations? Malformations or abnormalities of the baby. Sometimes malformation of the heart, or the intestine, of the kidney, of the brain. So that is another big question that everybody has. If 1,000 babies are born, around 5 to 10 babies will have some sort of abnormality, or let us say 1 out of 100. So the second question is, does COVID infection in the pregnant mother increase the risk of malformation in the baby? Again, the answer to that is that no. The malformation does not increase because the mother has got COVID infections. So no increase in pregnancy loss, no increase in malformation. The third question, do babies born to mothers who have COVID have difficulty at crying at birth, or is there a delayed crying at birth? That's called birth asphyxia. Usually, if 100 babies are born, around 15 babies need some help at the time of birth. That is why your pediatrician is there to take care of your baby. One baby will need at least 2 pediatricians to take care of the baby. Now, in a mother who has got a COVID infection, will the baby have more problems of asphyxia? Again, the answer is no. There is no increased risk of asphyxia. So no increased risk of pregnancy loss, no increased risk of malformations, and no increased risk of birth asphyxias. So what is the fourth one which I said was prematurity? Yes. If you are looking at 100 deliveries, around 12 or 13 babies will be born premature. Maturity means completing 9 months. So babies who are born premature are babies who are born before 9 months. So if mothers have got COVID infections, the risk of prematurity alone increases. But when the prematurity increases, the complications of prematurity also come in, which I'll talk about later. So these are the 4 major things we are looking at. One is pregnancy loss, second is malformation, third is birth asphyxia, and the fourth is the fact of prematurity. Now, as soon as a baby is born, most babies are normal, and babies born to COVID positive mothers are also normal. So we tend to keep the baby by the mother's side. In MGM Hospital, we have been practicing this even earlier. And this is called rooming in. So baby will be by mother's side. This is very good for bonding of the baby and for establishing breastfeeding. The question is, should you breastfeed? Yes, strongly yes. There is no evidence that breastfeeding is in any way contributing to spreading of COVID. So the World Health Organization and everyone, all the experts have said very clearly, room in with the baby mother and continue breastfeeding. 1 or 2 things we can do if the mother is COVID positive, especially in the last 14 days before delivery, that she could wear a mask, wash her hands, and keep the baby a bit further away from her as much as possible, except for feeding. So these are the things that we would be looking at. Aravind, does that answer my question?
Thank you very much, sir. Of course, that did answer the question very precisely. தமிழ் நண்பர்களுக்காக நான் இதை சுருக்கமாக நான் சொல்ல விரும்புகிறேன். ஸோ இப்போ நம்ம கேட்ட கேள்வி என்னன்னாக்கா, கர்ப்ப காலத்தில் ஒரு பெண்ணுக்கு வந்து கொரோனா இன்ஃபெக்ஷன் வந்துருச்சுனாக்கா அந்த குழந்தைய அது எந்த விதத்தில் பாதிக்கும் அப்படின்றதான் நம்மளுடைய கேள்வியாக இருந்தது. ஸோ ஒரு சார் பேஸ்ட் ஆன் நமக்கு இப்போ என்ன வந்து சயின்டிஃபிக் எவிடன்ஸ் இருக்கோ அதை பேஸ் பண்ணி அவங்க என்ன சொல்கிறாங்கன்னா, இந்த குழந்தையின் மேலே பெரிய அளவில் பாதிப்புகளை நம்ம உலக அளவில் பார்க்கறது இல்லை. அதாவது கரு இழப்பு, அபார்ஷன்னு சொல்லக்கூடியது ரொம்ப அதிகமாக நடக்கிறது இல்லை. இல்லை குழந்தையோட உறுப்புகளில் ஏதாவது மாறுதல்கள், ஏதாவது அப்நார்மாலிட்டி வந்து வர்றது வந்து அந்த மாதிரியான அதிகமாக வர்றதை நம்ம இது வரைக்கும் பார்க்கல. பட் நார்மல் டைமுக்கு பிறக்கிறதுக்கு கொஞ்சம் முன்னாடி பிறக்கிறது ஒரு சில இடத்துல வந்து நடக்குது. ஸோ அது வந்து சரியான மருத்துவ கண்காணிப்பில் அந்த குழந்தைங்களுக்கு தேவையான சிகிச்சையை நம்மளால் கொடுக்க முடியும். கண்டிப்பாக பிறந்ததுக்கு பிறகு ஒரு சில முன்னெச்சரிக்கை நடவடிக்கைகளோட அம்மா வந்து தன்னுடைய குழந்தை கூட இருக்கிறது கண்டிப்பாக சாத்தியம்தான். தாய்ப்பால் கொடுக்கறது கண்டிப்பாக முக்கியம். அது பண்ணுறதுல எந்த தப்பும் இல்லைன்றதை தான் சொல்லியிருக்காங்க. ஸோ இது ஐ திங்க் இதை வச்சு வந்து நம்ம பதட்டத்தை வந்து அவாய்ட் பண்ணிக்கலான்றது தான் இதுலேருந்து நான் எடுத்துக்கக்கூடிய மெசேஜாக இருக்கும். ஐ திங்க் ஆடியன்ஸ்க்கும் அதை தான் நாங்கள் கன்வே பண்ண விரும்புவோன்னு நான் நினைக்கிறேன். உங்களுடைய மருத்துவர், அதாவது மகப்பேறு நல மருத்துவர்கிட்ட நீங்கள் கண்டிப்பாக பார்த்துட்டு தான் இருப்பீங்க. ஸோ அவங்கக்கிட்ட தொடர்ச்சியான கண்காணிப்புலையும் அவங்களுடைய டெலிஃபோன் அட்வைஸ்லையும் நீங்கள் சரியாக நடந்துக்கிறதே போதுமானதாக தான் இருக்கும். இதுக்காக குழந்தைக்கு ஏதாவது பாதிப்பு வருமோன்னு நினச்சி ரொம்ப அதிகமாக பயப்படுறது, பதட்டப்படுறதுக்கு அவசியம் இல்லை அப்படின்றத நாங்கள் தெரிவிச்சுக்க விரும்புகிறோம். ஸோ So we'll move on to the next question, which I would address to our senior consultant pediatrician, Dr. Deepa. So of course, most of the parents who are watching this will have this $1 million question, like most others in the entire world. When is this pandemic going to end? When am I going to actually send my baby out there to play? When am I going to send my child to school to even go through the normal life that we all had in our childhood? And what are the safety precautions that I should advise my child to adopt? Like, I know the adults have to wash their hands, use hand sanitizers, use masks, but how do the children get all this? And should all children use these kind of masks? And is there any ideal situation where now I can say that, oh, I'm confident and that it is safe for me to send my child to school? How do you address these concerns of parents, madam?
Good afternoon to all the viewers. Thank you, Aravind, for the introduction, and thank you for the question. It truly is $1 million question. When will this pandemic end? I'm sure all of us are waiting for something like this to happen, but I think no one is able to predict rightly now when this pandemic will end. And so the important thing that we need to do right now is to keep ourselves and our children safe by following the guidelines set by the government. And a couple of things that we can do to keep our children safe. Just like in adults, I think the rule for children also is the same. Try not to take your child out of the house unless and until it is an absolute essential trip that you need to make. And especially if you're taking a child out, try to avoid poorly ventilated rooms, closed spaces, crowded places where a lot of people are going to crowd in, and things like that. It is better to avoid taking children to places like that. Though children are getting a milder infection, we do not want the children to carry the infection home and then spread the infection to other adults there, especially adults who are like grandparents who are older, or other people in the house who have got comorbidities. So it is important to keep our children safe. So one is definitely to avoid going out as much as possible, to avoid crowded places. The other thing is, of course, definitely masking. So as per the guidelines, all children above the age of 2 years, we say definitely they should be taught how to wear a mask. Now, wearing a mask can be very intimidating for a child. When a child steps out of the house, all of a sudden you just put a mask on the child's face, the child is definitely going to get very scared and will feel suffocated and things like that. So it is good to get the child used to wearing a mask when the child is in the house. So the way you can do that is, if it's a small child, you can get a mask which is kind of friendly, the famous a favorite cartoon character. You can have it either painted on the or drawn on the mask, or you can make it in the shape of a cartoon character, or you can tie the mask onto the child's favorite doll. And so the child starts, when this happens, the child starts realizing that this is not something that is going to harm me, this is not something that is going to suffocate me, and slowly the child will get accustomed to wearing a mask. So it is important that all children above the age of 2 years wear a mask if they have to step out of the house. And then, of course, hand washing. Now, making a child to wash their hands can be pretty intimidating because it's not something that the child is going to enjoy. But the way that you can make it a little bit more user friendly is, like, tell the child to sing happy birthday twice, and that would come to about 20 seconds of hand washing. And the child will usually enjoy doing that, and blowing up bubbles and things like that. So that is a way that we can make a child follow strict hand washing. And the other important thing that we need to emphasize to our children is that they should stop touching their face. So small children, you can kind of tell them that they've got germs, bad germs on their fingers, and that if they touch their faces, touch their mouth, their eyes, and their nose with it, they could be spreading that into their bodies. And so you could kind of try to explain that. So they should be taught not to touch their mouth and their eyes and their face. So that is the other way by which the infection is spread. So these are some ways by which things like this can be conveyed to a child. And the important thing is it should be conveyed in a very calm and in a atmosphere where there's not too much of fear being instilled to the child, because I think there is already so much of news being broadcast, and horrifying pictures children see on media and other people are talking about it. So I think all this should be done in a way that if you should try to tell the child that if the child follows these rules, the child is going to be absolutely safe and nothing is going to happen to the child. And if at all the child falls sick, the child is not going to be separated from the parent and be taken away to an isolation place and things like that, because that is not the way we usually manage children. If at all a child gets an infection also, the parents are always allowed to be with the child. So fear should definitely be removed from the child, but at the same time, important things like this, how to keep yourself healthy and how do you protect other people, that should definitely be instilled in the child. And supposing there is an adult, see, children usually get affected from an adult. Children are not going out, schools are closed, so there is no chance of a child going out and getting the infection from a place where the child is going off alone, unless it's an older child who's going to college or something like that. But otherwise, usually the source of infection is an adult. Now, if an adult is COVID positive in a house, the way you keep the children in the house safe, if they are COVID negative, is to practice something known as reverse quarantine. It's difficult, like living in an apartment, it is difficult to tell the child, you stay inside one room because, the other people are COVID positive. So that is going to be difficult. So easier than that would be you isolate the adult. You put the adult in a room and give the adult a separate toilet, separate utensils and things like that, so that the adult is isolated and the children are kept safe. So these are some of the ways by which we can keep children safe during this COVID pandemic. And about sending children out to play. Children definitely need to be outdoors. They definitely need to be playing outside. But when there is so much of community transmission, it might not be a good idea for children to mingle with children from other households, because that could turn out to be a super spreader event. And we do not want that to happen. So right now, the only option that we have is entertain children within the confines of our house, or even if they are outside, to be in a small cluster with people from the same household. So the energy that children have should be channeled properly. So parents will have to kind of come up with activities that children can do inside the house. Maybe parents will have to take the place of other children and play with their children, come up with games that they can play as a group, maybe board games, puzzles. They could kind of organize exercises that they can do together as a family, so that children will not miss going out and playing with other children. And the other question that Dr. Arvind asked was about regarding schools. Schools right now, when community transmission is so high, are closed, or they are being opened up in a phased out manner, and that will probably be what will happen. And if at all schools are opened again, it will be like with a staggered timetable where children will either, a few children will come in the morning and the others will come in the afternoon. So it will be so that social distancing will be maintained when children are in the classroom. And of course, children will be taught, hand sanitizers will have to be kept at different points in the school, so that children will have free access to them, so that they'll be able to use them. And all the furniture and the toilets and all that will have to be disinfected periodically. Parents will have to cooperate with the teachers, so that if any child has any symptom, including a runny nose, during which normally we would send a child to school, during this pandemic, a child with even mild symptoms, a low-grade fever, a mild sore throat, should not be sent to school, so that the risk of spreading that infection to other children in the school, and those children carrying it home and then spreading it to others in the house, would not happen. Thank you.
தேங்க்ஸ் a lot மேடம். ஐ திங்க் அவங்க சொன்ன பதிலில் அவங்களோட அனுபவம் அழகாக தெரிஞ்சிருக்கும்னு நான் எதிர்பார்க்குறேன். ஸோ குழந்தைங்களை பொறுத்த வரைக்கும் என்ன பண்ணணும்னு சொல்கிறது ரொம்ப சுலபம் தான், யார் வேணால் சொல்லிடுவாங்க. பட் எப்படி பண்ணணுன்றதுல தான் நம்மளோட க்ரியேட்டிவிட்டி நிறையா இருக்குது. அது அவங்க ரொம்ப டீட்டெயில்டாக ரொம்ப அழகாக தெளிவாக எடுத்து சொல்லிட்டாங்கன்னு நான் நினைக்கிறேன். ஸோ அதை சம்மரைஸ் பண்ணுறது ரொம்ப கஷ்டம், ஏன்னா அவங்க நிறைய விஷயங்கள் சொல்லியிருக்காங்க. பட் ஷார்ட்டாக சொல்லணுன்னாக்கா, இப்போ இந்த கொரோனா இன்ஃபெக்ஷன் நம்பர்ஸ் அதிகமாக இருக்கக்கூடிய இந்த சமயத்தில் குழந்தைகளை வெளியில் அனுப்புறது, ஸ்கூலாக இருக்கட்டும், விளையாடுறதுக்காக இருக்கட்டும், சேஃப் கிடையாது. கண்டிப்பாக நம்மளே அதை பார்த்துட்டு தான் இருக்கோம். ஈவன் நம்மளோட அப்பார்ட்மெண்ட்லேயே மற்ற குழந்தைங்களோட விளையாட விடுறது கூட எல்லா ஃபேமிலிலேருந்தும் ஒவ்வொரு குழந்தை 2 குழந்தை வரப்போகிறாங்க. ஸோ அது எல்லா ஃபேமிலிஸும் ஒன்றா கலக்கிறதுக்கு ஆல்மோஸ்ட் சிமிலர் தான். அதனால நம்ம இந்த சிச்சுவேஷனில் எல்லா குழந்தைகளையும் விளையாட விடுறது கூட கொஞ்சம் கஷ்டமான வேலை தான். பட் அப்படி இருக்கிற சமயத்தில் நம்ம குழந்தைங்களுக்கு எதுவுமே ஆஃபர் பண்ணாமல் அவங்களுடைய குழந்தை பருவத்தில் அவங்க அனுபவிக்க வேண்டியது எதுவுமே கொடுக்காம அவங்க நார்மலாக இருக்கணும்னு எதிர்பார்க்குறதும் நம்ம சைட்லேருந்து தப்பாக தான் இருக்கும். ஸோ அதுக்கு நம்ம ஆல்டர்னேட்டிவாக வீட்டுக்குள்ள குழந்தைகளுக்கு நம்ம எந்த அளவுக்கு அவங்களுக்கு உதவி செய்யலாம், அவங்களை எந்த அளவுக்கு எங்கேஜாக வச்சிருக்கலாம், அவங்களுக்கு எந்த மாதிரி விளையாட்டுகள், அவங்களோட நம்ம எப்படி வந்து குவாலிட்டி டைம் வந்து ஸ்பெண்ட் பண்ணலாம் அப்படின்றதெல்லாம் ரொம்ப அழகாக எடுத்து சொன்னாங்க. அண்ட் அஃப்கோர்ஸ் அவங்க சொன்ன மாதிரி நம்ம எல்லாருமே இந்த பேண்டமிக் எப்போ முடியும் அப்படின்றத தான் எதிர்நோக்கி இருக்கோம். பட் அது முடிகிற வரைக்கும் நம்ம எடுக்க வேண்டிய முன்னெச்சரிக்கை நடவடிக்கைகளை இந்த மாதிரி வல்லுநர்கள்கிட்ட கேட்டு தெரிஞ்சு அந்த சுச்சுவேஷனுக்கு தகுந்த மாதிரி நடக்க வேண்டியது ரொம்ப அவசியம். So I'll move on to the next question. Of course, we just heard from Dr. Deepa how much we need to understand in terms of taking care of a normal child. It's even more difficult when you're dealing with a sick child, isn't it? The whole family dynamics changes as soon as a child gets sick. And especially when the child is sick with symptoms of COVID infection, of course, the anxiety is super high. So then there is a question like, when should I get my child to the emergency department? What is actually the warning sign that I should be watching for in my child in terms of COVID? Because there is always this controversy about people overdoing something and people not bringing the children on time to hospital and making it late. So there's always this controversies that's going on. So in your experience, you have been spending lots of time in MGM Children's pediatric emergency services round the clock. So what are the common symptoms of COVID that you see presenting to the emergency department? How do you actually segregate the children who come for example, vaccination from the children who come with this COVID-like symptoms? And how do you assess them? How do you manage them? Do most of them require admission in the hospital? What is your experience, madam?
Thank you, Dr. Arvind, both for the introduction and for that question. That's a very good question, and I'm sure it's on the top of many people's minds, especially parents and families. So I'll try to answer, what do children present with commonly when they have COVID? Now, COVID in children has two presentations. One is like the acute presentation. That is, an acute presentation means when they come with the initial infection. And the other presents a little later. So as I talk about children when we're talking about children, we're talking about children from birth to the age of 18 years. So children who present with an acute infection, all over the world, they have found that most children who come with this have got common symptoms like fever, cold, cough, throat pain. Older children report loss of smell and taste. So those are the common COVID symptoms that children present with. Now, across the world, they found, as the pandemic progressed, that most of the time, thankfully, that the number of children with severe COVID disease, acute COVID disease, was fewer. So most children come with mild symptoms, and most of them can be treated as an outpatient. And we in MGM Children's have a home care program where we monitor these children. So then there is in that acute COVID infection, there's a small group of children who will be sicker, some with underlying already chronic conditions, some who will so those children can be sicker, and we will have to look at each child and decide at each point of time if this child will require more care or can be managed at home. Then there is another group of children. So that is acute COVID. Then there's another group of children. So I don't know, many of you may have heard about a phenomenon called MIS-C. That is a multi-inflammatory syndrome associated with COVID. So now they found that all across the world, after the acute COVID infection finished in adults, many children were presenting with MIS-C. Yes, this is a very small proportion of children, but these children tend to be sicker. What do these children present with? These children also present with fever, abdominal symptoms, abdominal pain, stomach pain, gastrointestinal symptoms like diarrhea, vomiting, and a lot of tiredness. So children with can present also with MIS-C, usually from up to 4 to 6 weeks after anybody else in the family has had a COVID infection. So how in MGM Children's, we have a 24/7 ER, emergency room, and we can see children at any point of time. So if your child has any symptoms, it is perfectly okay to come and show the child in the emergency room. In the emergency room, at the time of entry, we differentiate between children who have fever and respiratory symptoms from children who come for other things like vaccination. So there are they are differentiated at the entry itself. And these children will be seen, those who come with symptoms of COVID or symptoms where we suspect a past like MIS-C, and these children will be assessed. Most of these children have a mild, most of the children with acute infection have a mild infection. And these children, we often send them home with symptom treatment for their symptoms, like treatment for their fever, treatment for their cold, treatment for the cough, and tell the parents we just need to monitor them, follow them up on a home monitoring program. The children who are sicker will require admission, and Dr. Anitha will tell you more about how they are managed and how they are treated. The children with MISC also, it is very, the symptoms are a little different, but we will have to differentiate at each point of time when each child comes. And these children tend to more likely require admission. I hope that answers your questions, Dr. Arvind.
தேங்க்ஸ் அலாட் டாக்டர் நிஷா. அந்த நோயோட குணங்கள் குழந்தைகள் எப்படி இருக்குன்றத ரொம்ப அழகாக தெளிவாக சொன்னாங்க மேடம். ஸோ அதில் சுருக்கமாக தமிழில் சொல்லணுன்னாக்கா, அந்த கோவிட் இன்ஃபெக்ஷன் குழந்தைங்களுக்கு வந்த சமயத்தில் வந்து ஜுரம், இருமல், சளி, சில சமயங்களில் மூச்சு திணறல், அப்புறம் வந்து நமக்கு ஸ்மெல் வந்து சரியாக தெரியாமல் இருக்கிறது, மனம் சரியாக தெரியாமல் இருக்கிறது, நாக்கில் வந்து ருசி சரியாக தெரியாமல் இருக்கிறது, இந்த மாதிரியான சிம்டம். சில சமயங்களில் வந்து ஸ்கின்ல ரேஷஸ் மாதிரி வருது, இது மாதிரி வந்து வரலாம், வாய்ப்பு இருக்குது. ஸோ கோவிட் இன்ஃபெக்ஷன் முடிஞ்சு போய் சில நாட்களோ இல்லை சில வாரங்களுக்கு அப்புறமாவோ வரக்கூடிய ஒரு சில பிரச்சனைகளும் உலகளாவிய லெவலில் வந்து நம்ம பார்க்குறோம். அதுக்கு பேர் தான் மேடம் சொன்னாங்க MISC அப்படின்னு, மல்டி சிஸ்டம் இன்ஃப்ளமேட்டரி சிண்ட்ரோம் இன் சில்ட்ரன் அப்படின்னு ஆங்கிலத்தில் சொல்கிறாங்க அதை. அந்த நோயையும் நம்ம வந்து கண்டுபிடிச்சு அதுவும் கோவிட் வைரஸோட தாக்கத்தினால இருக்கலாம் அப்படின்றத நம்ம தெரிஞ்சுக்க வேண்டியது ரொம்ப அவசியம். ஏன்னா இது முக்கியமாக குழந்தைகளில் தான் அதிகமாக நம்ம பார்க்குறோம் உலகளாவிய டேட்டாவில் பார்க்கும்போது. ஸோ இந்த நோயில் வந்து நமக்கு வந்து சில நாட்களாக ஜுரம் வந்து நிற்காமல் அதிகமாக அடிச்சுட்டே இருக்கிறது, வயிறு சம்மந்தப்பட்ட பிரச்சனைகள், வயிறு வலி, வாந்தி, இல்லை வந்து லூஸ் மோஷன் மாதிரி ஆகுறது, சாப்பிட பிடிக்காம, இல்லை அந்த மாதிரி ஒரு பசி இல்லாமல் இருக்கக்கூடிய நிலைமை, இல்லை அவங்களோட ஆக்டிவிட்டி, குழந்தை வந்து சிரித்து விளையாடிட்டு இல்லாமல் ஒரு மாதிரி சோர்வாக இருக்கக்கூடிய ஒரு நிலைமை இருக்கிறது. சம்டைம்ஸ் இன்னும் கொஞ்சம் சிவியராக போச்சுனாக்கா அவங்களுடைய ரத்த அழுத்தம் குறைபாடு ஏற்படுறது, இது மாதிரியான சூழ்நிலைகள் ஏற்படுறதுக்கான வாய்ப்புகள் உண்டு. ஸோ இதனால அவங்க என்ன சொல்ல வராங்கன்னா, குழந்தைகளுக்கு இந்த கோவிட் இன்ஃபெக்ஷன்லேருந்து வெளியில் வந்துட்டா கூட சில வாரங்களுக்கு சில மாதங்களுக்கு வேறு எதுவும் தொந்தரவுகள் வந்தால் கூட எமர்ஜென்சி டிபார்ட்மெண்ட்டில் ஒரு மருத்துவமனையை அணுக வேண்டியது ரொம்ப முக்கியம் அப்படின்றது அவங்க சொல்கிறாங்க. ஸோ அந்த இன்ஃபர்மேஷன் நம்ம எடுத்துக்க வேண்டியது ரொம்ப அவசியம். தேங்க்ஸ் அலாட் மேடம் ஃபார் தட் எலாபரேட் ரிப்ளை. So I'll now move on to Dr. Anitha. She's our pediatric intensive care consultant. So, the word intensive care unit itself strikes a fear among everybody. I mean, it may be public or doctors, especially after this COVID pandemic has set in. Because as soon as you say that there is a family member who's admitted in ICU, the spontaneous reaction is, oh my God, that's how people often react. And they often go on ventilator. Sometimes, unfortunately, their outcome is fatal also. So what is the trend that you are observing with children? Do many of them require ICU admission? And once they get admitted, what do the parents expect? Would they be permitted to visit their children? Because they would also be at risk of infection if they enter the ICU area. But on the other hand, no parent would want to leave their child unattended by them altogether. So how do you take care of this socially sensitive issue and the emotional component of a child's care despite requiring intensive care in children? Can you please throw some light on that, madam?
Thank you, Arvind, for the very relevant question. I've come to the, I think ICU is where every parent does not want their child to go. And like Dr. Arvind mentioned, the word ICU itself brings up a very scary image of monitors and other machines which are beeping and frightening to the children as well as the parents. So ICU is the place when we admit children who become sicker and who cannot be managed in the wards. They need closer attention. They need more continuous monitoring than we can do in the wards, like the medical wards or the pediatric wards. So thankfully, like I think during the first wave, we did not have to admit any children with severe pneumonia requiring ICU care. I think that was the experience not only at our center, but in other pediatric hospitals and in Chennai and all over the world. But children did have to get admitted into the ICU for the problem that Dr. Nisha and Dr. Arvind mentioned, which is the MIS-C. So they present with stomach pain, vomiting, loose stools. They're more sleepy. children do not eat very well, and they can go on to have low blood pressure and other symptoms. So this is because of an overactive immune system. So children have to be admitted and closely monitored in the ICU for MIS-C. There are reports, I think, coming out in the media that this wave is seeing more children with even pneumonia requiring ICU admission. But it is like it's not going to be any different from other pneumonias that we have been managing all through our lives. So when due to other causes as well, other viruses, other bacteria. So we would start off with giving them oxygen. Then if the child has some breathing difficulty, they would go on to require some non-invasive form of ventilation. And if that is not working, then we move on to the invasive ventilator. A ventilator is a machine which is going to help the child breathe. So by putting a tube into the child's airway and connecting it to the machine, the ventilator will do the work of breathing for the child, give more oxygen a little under pressure so that the oxygen levels can be maintained. This we do when with a bit of sedation so that the child does not feel any discomfort or pain. Now coming to the question of whether parents will be allowed into the ICUs. During normal times, we would allow parents to visit their child, and if the child was awake, for non-invasive ventilation, we would even allow the parents to be with the child, to comfort them, to care for them. They can take feeds, and they can stay at the bedside. But once they get ventilated and we sedate them, they don't need the parents' presence. There is one nurse for every child who will take care of every need of the child. The child will be connected as to what to expect. The child will be connected to the ventilator. Apart from that, the child will have multiple infusions of medicines, antibiotics. We can even feed the child through a nasogastric tube once they are settled enough. The child will be connected to a monitor which will give us readings of the child's heart rate, respiratory parameters, oxygen levels, and if required, even the blood pressure. So during COVID times, of course, we are not allowing parents to visit the child, and but they can see the child over a video call or a video visit, when we would also update the parent about the child's condition twice a day or even more frequently as required. So I hope that answers the question that Arvind raised.
Sure. Thanks a lot, madam. Of course, it does. I think you have given a very comprehensive, clear picture. ஸோ ஒரு சுருக்கமாக சொல்லணும்னா, நல்ல விஷயம் என்னென்னா, குழந்தைகளில் நிறைய பேருக்கு தீவிர சிகிச்சை பகுதியில் அட்மிட் பண்ணுற அளவுக்கு இந்த கோவிட் இன்ஃபெக்ஷன் மோசமாக போகிறது இல்லை. அண்ட் அப்படி ஒரு சில பேர் அட்மிஷன் போகிறவங்களுக்கும் அவங்களுடைய அவுட்கம் வந்து ஓரளவுக்கு நல்லா தான் இருக்குது. ரொம்ப வயது முதியவர்களுக்கு இருக்கிற அளவுக்கு ரொம்ப பாதிப்பு அதிகமாக இருக்கிற மாதிரியோ, இல்லை ரொம்ப கஷ்டமாக இருக்கிற மாதிரியோ குழந்தைகளில் நம்ம அந்த அளவுக்கு பார்க்கறது இல்லை அப்படின்றத தான் நம்ம தெரிஞ்சுக்கிறோம் மேடம் சொல்கிறதுலேருந்து. அண்ட் அஃப்கோர்ஸ் நம்ம குழந்தைய அட்மிட் பண்ணியிருக்கோன்னும் போது வெறும் மருத்துவ தேவை மட்டும் இல்லாமல் அதை தாண்டி குழந்தைக்கு அன்பாக அரவணைப்பாக இருக்க வேண்டிய அவசியம் கண்டிப்பாக உண்டு. இது வந்து கோவிட் வரத்துக்கு முன்னாடியிலேருந்தே இந்த லாஜிக்கோடு தான் நம்ம உலகளாவிய அளவில் எல்லா இடத்துலையுமே குழந்தைகளுக்கு மருத்துவம் கொடுக்கக்கூடிய எல்லா மருத்துவமனைகளுமே இதை வந்து ப்ராக்டிஸ் பண்ணிட்டு தான் இருக்கணும். ஸோ நம்மளும் அதை எம்ஜிஎம்லேயும் நம்ம பண்ணுறோம். ஸோ பட் என்னதான் நம்ம கேர் எடுத்துக்கிட்டாலும் பெற்றவர்களுக்கு இல்லை அவங்க குடும்பத்தினருக்கு வந்து ஒரு பதட்டம் இருக்க தான் செய்யும். நம்ம குழந்தை எப்படி இருக்காங்களோ, அவங்கள பார்க்க முடியலையே, அவங்க அழறாங்களா என்னன்ட்டு. ஸோ அதுக்காக அவங்களுக்கு ஒரு விதத்தில் வந்து இன்ஃபெக்ஷன் வரக்கூடிய ரிஸ்க்கும் நம்ம குறைக்கணும். அதே சமயத்தில் அவங்களுக்கு குழந்தைய பார்க்கறதுக்கான வாய்ப்பையும் நம்ம கொடுக்கணுன்றதுனால வீடியோ கால்ஸ் இதுக்குன்னே நம்ம வந்து ஐபேட் மாதிரி வச்சு ஃப்ரீக்வெண்ட்டாக குழந்தை கூட இன்ட்ராக்ட் பண்ணுறதுக்கு நம்ம வழி ஏற்படுத்தி கொடுக்குறோம். அண்ட் குழந்தை ஓரளவுக்கு இம்ப்ரூவ் ஆகி சரியாகி போகும்போது அஃப்கோர்ஸ் அவங்க பேரண்ட்ஸோட இருக்கிறதுக்கூடிய வாய்ப்புகள் அவங்களுக்கு கிடைக்கும். குழந்தை கொஞ்சம் இம்ப்ரூவ் ஆனதுக்கு அப்புறமா அவங்களுக்கு பால் குடிக்கிற நிலைமையில இருக்கக்கூடிய சின்ன குழந்தைகளுக்கு டியூப் மூலமாவோ இல்லை பாலாடை மூலமாவோ அந்த குழந்தைக்குன்னு பிரத்யேகமாக இருக்கக்கூடிய ஒரு செவிலியர் வந்து அவங்களுக்கு அதை கொடுப்பாங்க. ஸோ அவங்கள காமா வச்சுக்கக்கூடிய வாய்ப்புகள் நமக்கு இருக்கும். அண்டு இப்போ வென்டிலேட்டர் மிஷினில் போடுறது வந்து எல்லாருக்கும் ஒரே மாதிரியான வென்டிலேட்டர் வசதி தேவைப்படுறதில்ல. ஒரு சிலருக்கு வாய் மூலமாவோ இல்லை மூக்கு மூலமாவோ ஒரு குழாய் போட்டு அது மூலமா வந்து வென்டிலேட்டர்லேருந்து நம்ம சப்போர்ட் வந்து நம்ம கொடுப்போம். அது எண்டோட்ரக்கியல் இன்டுபேஷன்னு சொல்லுவாங்க. ஒரு சிலருக்கு அது இல்லாம முகத்துல வந்து ஒரு மாஸ்க் மாதிரி வச்சு மட்டுமே ப்ரெஷரையோ இல்லை ஆக்சிஜனையோ வந்து நம்ம கொடுக்க முடியும். இந்த டியூப் போடாமல் இருக்கக்கூடிய குழந்தைகளுக்கு அவங்க சுயநினைவோட இருக்கக்கூடிய வாய்ப்பு வந்து நிறையவே உண்டு. அவங்கள வந்து நம்ம மயக்க நிலையிலையோ இல்லை மருந்துகள் கொடுத்து அவங்கள தூங்க வச்சிருக்கணுன்ற கட்டாயம் கிடையாது. ஸோ அது மாதிரி இருக்கக்கூடிய குழந்தைகள் வந்து வீடியோ கால்ஸில் அவங்க பேரண்ட்ஸ் கூடயோ மற்ற ஃபேமிலி மெம்பர்ஸ் கூடயோ வந்து இன்ட்ராக்ட் பண்ண கூட வாய்ப்புகள் வந்து கண்டிப்பாக உண்டு. பட் நம்ம உள்ள வந்து குழந்தைகளுக்கு எஸ்பெஷலி ஒரு குழந்தைக்கு ஒரு நர்ஸ்ன்ற மாதிரி நம்ம வந்து போட்டு அந்த குழந்தைக்கு தேவையான மருத்துவ தேவை மட்டும் இல்லாமல் மற்ற எல்லா தேவைகளையும் கேர் எடுத்துக்கிறதுக்காக நம்ம அரேஞ்ச்மெண்ட்ஸ் வந்து நம்ம பண்ணுறோம். அஃப்கோர்ஸ் தட்ஸ் பி த ஐடியல் சுச்சுவேஷன். Okay, so I'll move on to the next question, which I'll address to Dr. Deepa. So one of the mothers called me and asked me this question. Doctor, my baby is 2 months old now, and she is due for her routine vaccination. Should I really go to a hospital at this point of the pandemic to vaccinate my baby? Is it that urgent? Why don't I wait for a few months, or maybe why don't I do it in the second year of life? Let this pandemic get over altogether. And she also had an added question asking that my nephew is about 15 years old. At least would you say that his vaccination can be postponed, because we are really afraid to step into the hospitals during this pandemic. How would we manage these situations, madam? What is the practical solution for this problem?
Thank you for the question, and a very, very important question, I would say. Regarding immunization, during the first lockdown that we went through, when the whole of India was locked down, even then the Ministry of Home Affairs and the Government of India had allowed essential services to run. And immunization services were considered as essential medical services. So even during the lockdown, immunization services were going on routinely at MGM Children's. So we were giving all immunizations here. And that is what I would like to encourage every parent, especially immunizations in the first year of life are extremely important. And we do not want any child to delay vaccinations for any reason at all, because as I said earlier on also, COVID in children usually goes off as a minor illness. But some of these illnesses that we are trying to protect with vaccinations in the first year of life can be very, very serious illnesses, where either the child can lose their life, or even the child can recover with some kind of a complication. So these are the kind of illnesses that we are trying to prevent with vaccinations in the first year of life. So it is extremely important that no child misses those vaccinations, and they have to be given at the correct gap. So if a first vaccine is given at 6 weeks, we want the next vaccine to be given at 4 weeks later. So we do not want those vaccines to be postponed for any reason at all. So I would definitely encourage all parents, especially a 2-month-old baby, there is no reason why the child should not be given the vaccination, even when there is so much of community transmission. So that is number one. The second thing that I would like to say is immunization visit doesn't just finish with just giving the shot to the baby. It is a time when the baby is being assessed. We assess the growth of the baby. Is the baby gaining weight adequately? Is the baby growing well? Is the baby developing normally, on par with other children of the same age? Is the children getting a balanced diet? Or are there any other concerns that the mother has? So these are the things that we go through when a child comes in for an immunization visit. And it is extremely important that these things are picked up early, so that they can be taken care of before the child lands up in a full-blown problem. So it is extremely important. These immunization visits are actually extremely important, not only for the shot, which will protect the child from very serious illnesses, but it is also a time when early conditions can be picked up and attended to. So I definitely would encourage all children to get their vaccinations. Now, coming to a 15-year-old, that is another. Adolescent immunization is extremely important. So that is the other age where they are extremely vulnerable, because they are going out to colleges, they are going out, most of them going to hostels and things like that. So those vaccinations are extremely important. In my practice, what I see is most of the children, have not received any vaccination after the age of 5. And many parents do not know that there are vaccinations for children older than that. But there are numerous vaccinations, and they definitely must be given to all adolescents up to the age of 18. All of them should be vaccinated. And maybe they are not as urgent as it is for a 2-month-old baby. So if you are in a lockdown zone and you're in a micro containment zone, maybe you can postpone the vaccination till the lockdown is lifted. So that amount of postponement for an adolescent child might be acceptable, but for a 2-month-old baby would not be acceptable. And because it is considered as an essential medical service, there should not be any problem for you to reach the hospital. Now, certain precautions that you can take when you're coming for an immunization visit. One is, as much as possible, try to use your own transport so that you're not exposed, to other people by taking public transport. Elderly people, that is grandparents, or elderly people in the family who have got other comorbidities, should not be accompanying the child to the hospital. And it is good to take an appointment with your doctor, before you land up in the hospital for an immunization visit, so that the doctor is ready, the doctor is prepared, and you don't have to come and wait, to wait to see the doctor, because you want to come in and you want to leave as soon as possible. So if you have taken an appointment and you have discussed things with your doctor, you will be able to come and minimize the time that you are in the hospital and get everything done and leave. So this is what I would encourage regarding immunization. And a small thing that something of interest that I had read, when there was the Ebola outbreak, in Africa, everybody was trying to control the epidemic. So there was a decrease in the immunization coverage by about 25%. So at the end of it, when they went back through the data, they found out there were 2,000 people who had died of Ebola, but double the number had died of measles, because the measles vaccine had been omitted. There was no time for the healthcare system to immunize the children there. And that is something that we do not want to see in our country here. Already the healthcare workers are overwhelmed by managing the COVID cases, because we are having so much of community transmission and we are going through what is called the second wave. So we do not definitely want an outbreak of vaccine preventable diseases where we have to channel all our energy trying to manage that. So immunization is definitely an urgency, and it should be given prime importance, and parents should not be concerned about coming to the hospital. Here at MGM Children's, we have an excellent triaging system where children who come for vaccinations are triaged and they are sent up to the OPD, whereas other children who come with other symptoms are seen in a separate area. So there is no risk of mixing of these children where there is a possibility of transmission of the infection. So I would encourage every parent to please get their vaccinations done. In case you have missed a dose, don't worry. It's not like there's no use in giving it. There is something known as catch-up vaccination. So please come and see the pediatrician so that we will be able to chart out something so that we can catch up and get your child up to date.
Thanks a lot, madam. I think that's a very essential and very important message to be conveyed to the public. ஸோ இது சுருக்கமாக சொல்லணும்னா, 1 வயசு 2 வயசுக்கு கம்மியாக இருக்கக்கூடிய குழந்தைகளில் தடுப்பூசி, அதாவது வழக்கமாக நம்ம போடக்கூடிய தடுப்பூசிகளை தாமதம் பண்ணுறதுக்கோ இல்லை நிறுத்தி வைக்கிறதுக்கோ காரணம் இல்லை அப்படின்றது தான் மேடம் சொல்ல வராங்க. ஏன்னா நம்ம இந்த தடுப்பூசிகள் இந்த ஸ்கெடியூலில் அரசாங்கமோ இல்லை உலக சுகாதார மையமோ இந்த தடுப்பூசிகளை போடணும்னு சொல்லி இருக்கிறதுக்கு ஒரு காரணங்கள் இருக்குது. நமக்கு பல வருடங்களாக பல நாடுகளில் நமக்கு கிடைச்ச அனுபவத்து மூலமாக நம்ம இந்த தடுப்பூசிகளை குழந்தைகளுக்கு போட வேண்டியது ரொம்ப முக்கியம் அப்படின்றதுனால தான் நம்ம இந்த ஸ்கெடியூல்னு ஒன்று போட்டு வச்சுருக்கோம். அது எதனாலன்னு சொன்னால் 2 விளைவுகள் தான் நம்ம பயப்பட வேண்டியது. ஒன்று உயிரிழப்பு, இன்னொன்று குழந்தைய பிற்காலத்தில் நிரந்தரமான பாதிப்புக்கு உட்படுத்துறது. இங்கிலீஷில் மார்டாலிட்டி மார்பிடிட்டின்னு நம்ம சொல்லுவோம். ஸோ இது ஏற்படுத்தக்கூடிய சில நோய்களில் குழந்தைகளுக்கு வரக்கூடாது அப்படின்றதுனால தான் நம்ம போடக்கூடிய எல்லா தடுப்பூசிகளுமே நம்ம போடுறோம். எடுத்துக்காட்டுகளுக்கு சொல்லணும்னா, அம்மை நோய் மீசல்ஸ்னு சொல்கிறது, இல்லை டிப்தீரியா தொண்டை அடைப்பான்னு சொல்லுவாங்க, இல்லை பெர்டூசிஸ் கக்குவா நெருமல்னு தமிழில் சொல்கிறது. இது மாதிரியான உதாரணங்கள்லாம் நீங்கள் எடுத்துக்கிட்டிங்கன்னா, இந்த நோய்களும் எப்படி கோவிட் நோய் இருக்கோ அதே மாதிரி இந்த நோய்களும் குழந்தைகளில் எஸ்பெஷலி உயிர்கொல்லி நோய்களாக இருந்திருக்கிறத நம்ம வரலாறுல தெளிவாக நம்ம பார்க்குறோம். ஸோ இந்த நோய்கள் குழந்தைகளுக்கு வரக்கூடாதுன்றதுனால தான் அது அந்த ஸ்கெடியூலில் இருக்குது. அதனால கோவிட்லேருந்து பாதுகாக்க வேண்டியது எந்த அளவுக்கு முக்கியமோ அதே அளவு இந்த நோய்கள்லேருந்தும் குழந்தைகளை பாதுகாக்க வேண்டியது ரொம்ப அவசியம். அதனால இந்த தடுப்பூசிகளை வந்து தாமதப்படுத்துறதோ நிறுத்தி வைக்கிறதோ அவசியம் இல்லை. ஆனால் அதே சமயத்தில் நம்ம கோவிட் வந்து நம்ம குழந்தைக்கு வரக்கூடாதுன்றதுல நம்ம எடுத்துக்கக்கூடிய முன்னெச்சரிக்கை நடவடிக்கைகளும் ரொம்ப அவசியம்தான். அந்த விதத்தில் நம்ம உங்களுடைய மருத்துவரை நீங்கள் முன்கூட்டியே அணுகி அவங்கக்கிட்ட நேரத்தை பேசி வச்சு அந்த நேரத்தில் நீங்கள் கரெக்டாக போய் உங்களுடைய தடுப்பூசியை போட்டுட்டு வர்றது உங்களுக்கும் நல்லது, அவங்களுக்கும் பிளான் பண்ணுறதுக்கு ரொம்ப வசதியாக இருக்கும். கூட போகும்போது முடிந்த வரைக்கும் முதியவர்களை கூட அழைச்சிட்டு போகாமல் இருக்கிறது கட்டாயம் நல்லது. ஏன்னா நீங்களே நியூஸில் பார்த்துருப்பீங்க, வயது முதிர்ந்தவர்களுக்கு இந்த கோவிட் இன்ஃபெக்ஷனுடைய தாக்கம் வந்து ரொம்ப அதிகமாக இருக்கும். ஸோ ப்ரிஃபரபிளி அம்மா அப்பா இல்லை மாமா சித்தி இந்த மாதிரி கொஞ்சம் யங்கர் ஏஜ் குரூப்பில் இருக்கிறவங்க குழந்தைய கூட்டிகிட்டு வந்து போடுறது நல்லது. கொஞ்சம் பெரிய குழந்தைங்க ஒரு 15 வயசு 16 வயசு குழந்தைகளுக்கும் தடுப்பூசிகள் கண்டிப்பாக தேவை. அவங்களுக்கும் வந்து அரசாங்கத்திலையும் சரி எல்லா இடத்துலையும் அவங்களுக்கு அந்த வயசுக்கு தேவையான தடுப்பூசிகள் கிளியராக சொல்கிறாங்க. நிறைய சமயம் அது கோவிட் வரதுக்கு முன்னாடியிலேருந்தே அது மிஸ் ஆகிடுது. பட் அது பண்ணாமல் போட்டுக்க வேண்டியதும் கட்டாயம் அவசியம். ஸோ இந்த ஒரு பேண்டமிக் சுச்சுவேஷனில் நீங்கள் ஒரு லாக்டவுன் ஜோனில் இருக்கீங்கன்னு சொன்னாக்கா அந்த வயசில் இருக்கக்கூடிய தடுப்பூசிகளை ஒரு சில மாதங்கள் தள்ளி போடுறது தப்பு கிடையாது. பட் நம்ம சொல்ல வர்றது அது முக்கியம் இல்லை அப்படின்றத அர்த்தம் கிடையாது. கண்டிப்பாக அதுவும் முக்கியம்தான். பட் கொஞ்சம் ஒரு சில மாதங்கள் தள்ளி போகிறதுனால பெரிய அளவில் பாதிப்பு வரல அப்படின்றத நம்ம புரிஞ்சுக்கிட்டு அதையும் நமக்கு ஏர்லியஸ்ட்டாக அடுத்த வாய்ப்பு எப்போ கிடைக்குதோ அப்போ அதையும் போய் போட்டுக்க வேண்டியது கட்டாயம் அவசியம். ஸோ அதுதான் மேடம் சொல்ல வராங்க. ஸோ I'll address my next question to Professor Dr. Binu. So we heard Dr. Anitha speak about children getting admitted to intensive care unit and how they are managed and how they present to the pediatric intensive care unit. Sir, you are a specialist who deals with newborn babies in the first month of life. Do these babies also get COVID infection, especially when they are born to COVID positive mothers? How do they respond? Do these babies also get severe infection affecting their lungs? Do they also require oxygen support and ventilator machine support? Does it leave any long-term impact on these children at all? What has been your experience and the world literature, sir?
Thank you, Aravind. That is a good question, and I'm sure that concerns every mother who has got an infection. See, just to give a brief perspective, babies who are born often tend to have mild breathing difficulties needing monitoring and admission in the intensive care. The more premature the baby, more the chance of the breathing difficulty. For example, if you have got 100 mature babies, hardly 3 of them will need breathing difficulty needing admission in the ICU. While if you're talking about a 7-month or that is a 26 weeker, almost 100% of the babies will have some sort of breathing difficulty. If you're looking at an 8th month completed, that is a 32-week baby, you're looking around 50% of the baby having a breathing difficulty. Most of the breathing difficulty needing ICU admission in a newborn is not because of what we would talk about as a pneumonia. It is not an infection of the lung. It is mainly a problem of adaptation. There is fluid in the lung which has still not been absorbed, or it could be in a premature baby more of an immature lung which needs time to mature over the next 3 to 5 days. Very rarely it is because of an infection of the lung, like a viral infection, like a COVID infection. So, as I said earlier, in a COVID positive mother, that there's a tendency for babies to be born premature. Therefore, the admission rate of these premature babies will be there. But the problem that the babies face and the breathing difficulty that the baby face is not because of the COVID-related pneumonia, but because of the immature lungs. And the management is just like we have been doing for the last so many decades, a standard care of the baby needing oxygen, very rarely needing more breathing support, and very occasionally needing ventilation. And as far as the world literature is concerned, there is almost no death in a preterm baby because of a COVID associated pneumonia so far. Most of them, if at all they needed admission, was around day 5, and they need around 10 days of hospitalization, and they do very well. Long-term damage to the lung is hardly ever known, but I think only later we will know about it. But so far, there is no reports in the literature even talking about that. Now, not only are the lungs affected if the patient has got a COVID infection, it could be problems like feeding-related issues, cyanosis or the blue baby, the heart not functioning well, skin rash, poor feeding. All these issues can also come, and these are the common reasons for admission for many of the COVID infected babies. But the problem that the babies face, and the management is just like we have been doing for the last so many decades, a standard care of the baby needing oxygen, and very rarely it is because of a COVID associated pneumonia so far. Most of them, if at all they needed admission, was around day 5, and they need around 10 days of hospitalization, and they do very well. Long-term damage to the lung is hardly ever known, but I think only later we will know about it. But so far, there is no reports in the literature even talking about that. in the unit, and all these are things which we are used to for years to come. So I do not think this is a big problem so far, and we'll have to see how this second wave is going to do.
Thank you, sir. That was quite well put. ஸோ சார் என்ன சொல்ல வராங்கன்னா, பச்சிளங்குழந்தைகள், அதாவது பிறந்ததுலேருந்து 1 மாதத்துக்குள்ளே இருக்கக்கூடிய குழந்தைகளில் இந்த கோவிட் இன்ஃபெக்ஷனுடைய பாதிப்பு பெரிய அளவில் நம்ம இது வரைக்கும் பார்க்கறதில்ல. தீவிர சிகிச்சை பகுதியில் அவங்கள அட்மிட் பண்ணி அங்கே ஆக்சிஜனோ வென்டிலேட்டர் சப்போர்ட்டோ கோவிட்னால அதிகமாக தேவைப்படுற மாதிரியான ஒரு சூழ்நிலையை நம்ம இது வரைக்கும் எதிர்கொள்ளலை. ஆனாலும் கொஞ்சம் டைமுக்கு முன்னாடி பிறக்கக்கூடிய குழந்தைகளுக்கு சில உறுப்புகள் ஜென்ரலாகவே வந்து இம்மெச்சூராக தான் இருக்கும். அதில் நுரையீரல் ஒரு முக்கியமான உறுப்பாகவும் நம்ம பார்க்குறோம். ஸோ அது மாதிரியான குழந்தைகளில் நிறைய குழந்தைகளில் எனிவே கொஞ்சம் ஆக்சிஜனோ இல்லை கொஞ்சம் ப்ரெஷரோ இல்லை ஒரு வென்டிலேட்டரோட சப்போர்ட்டோ வந்து நிறைய சமயத்தில் தேவைப்படுது. பட் அது கோவிட்னால தான் அந்த மாதிரி மோசமாக இருக்குன்றதுக்கான தெளிவான ஒரு சூழ்நிலையை நம்ம இது வரைக்கும் எதிர்கொள்ளலை. அது ஒரு விதத்தில் நல்ல விஷயமா தான் நம்ம பார்க்க வேண்டியிருக்கு. ஸோ கோவிட் இன்ஃபெக்ஷன் சிவியராக இருக்கிறதுனால ரொம்ப நாள் வென்டிலேஷன் மிஷினில் இருந்த பச்சிளங்குழந்தையோ இல்லை அதனால உயிரிழப்பு ஏற்பட்ட மாதிரியோ இது வரைக்கும் நம்ம வந்து எதிர்கொள்ளலை உலக அளவில். அண்டு இந்த நோயே வந்து நம்ம உலகளவிய அளவில் புதுசு. ஸோ இந்த நோயுடைய தாக்கம் பெரியவர்கள் எப்படி இருக்குன்றதையே நம்ம வந்து தினசரி நம்மளுடைய அறிவை வந்து நம்ம பெருக்கிட்டு இருக்கிறோம். இன்னும் நமக்கு முழுமையான ஒரு அறிவு கிடைக்கலன்றது உண்மையாக தான் நம்ம ஒத்துக்கணும். ஸோ குழந்தைகளில் பிற்காலத்தில் இதனால ஏதாவது பாதிப்பு வருமா அப்படின்றது இப்போதைக்கு இருக்கக்கூடிய நிலைமையை வச்சு பார்க்கும்போது அது நமக்கு இல்லைன்ற மாதிரி தான் தோணுது. அதுக்கான சாத்தியம் கம்மி அப்படின்னு நம்ம சொல்லலாம். பட் எக்ஸாக்டாக என்ன நடக்கும் அப்படின்றதுக்கு நம்ம பொறுத்திருந்து பிற்காலத்தில் பார்க்கும்போது நமக்கு இன்னும் பெட்டராக புரிய வரும்ன்றதை நம்ம நம்புகிறோம். So I'll address my next question to Dr. Nisha, because she's part of emergency services. She deals with the kids as they are brought in with possible symptoms of COVID infection. How do you actually test these kids for presence of COVID infection? In adults, we have all seen the pictures in news articles and TV channels where they stick in a swab in their nose and take some samples. They do take bloods for those who are admitted to look at the severity of markers of infection. Also, I get questions from several parents. Doctor, I had a fever and cold. My doctor advised me to get a CT scan done. What should I do to my child? My child also has fever and cough. Shall I take my child with me when I go for a CT scan? Why don't I get it done away on the same day? Otherwise, I'll need to go for the second time as well. So how do you evaluate these children, and what do you advise regarding X-rays and CT scan for children, madam?
Thank you, Dr. Arvind. That's a very relevant question. So, as I said earlier, most children who come to the emergency room with acute COVID infection, that is an acute infection that is happening mostly because of an infection in another family member, most of them are very mild. Most of them have just symptoms like fever, cold, cough, and most of the time we don't require them to have any tests. We just treat them for their symptoms, and as I said, home monitoring, and we monitor them from home. There are few of those children with acute symptoms, very few, who may require further investigation. But those children will possibly also require admission. So most of the children who come with acute COVID infection don't require any testing and don't require CT scans and don't require the usual blood investigations that adults have known to be have taken for them. How do we test them for an acute COVID infection? Yes, the testing of the RT-PCR is very similar. We take swabs from children, very similar to how it's taken in adults, and it is taken quite gently. Now, the second group of children who come with Miss C, as Dr. Anitha also said, they will be more sick, and they will require hospitalization, and they will require a certain number of investigations, which will come along with a hospitalization. These children, we test for COVID antibodies, which is a blood test. I hope that answers your question.
Sure, that definitely does, Dr. Nisha. Thanks a lot for the very crisp and precise, very clear reply. I think அவங்க சொல்ல வர்றது என்னன்னாக்கா, குழந்தைகளில் நல்ல விஷயம் என்னென்னா, ரொம்ப தீவிரமான கோவிட் இன்ஃபெக்ஷன் பெரும்பாலான குழந்தைகளில் நம்ம இது வரைக்கும் பார்க்கல. ஸோ அது மாதிரியே இருக்கக்கூடிய குழந்தைகளுக்கு அவங்க பார்க்குறதுக்கு எப்படி இருக்காங்கன்றதை பொறுத்து தான் என்னென்ன பரிசோதனைகள் அவங்களுக்கு பண்ணணும் அப்படின்றத மருத்துவர்கள் முடிவு செய்கிறாங்க. அதில் இப்போ கோவிட் இன்ஃபெக்ஷன் இருக்கா இல்லையா அப்படின்றத பார்க்கறதுக்கு அந்த மூக்குலேருந்தோ இல்லை தொண்டையிலேருந்தோ சளி வந்து எடுத்து அந்த டெஸ்ட் பண்ணுறது அடல்ட்ஸ்க்கு பெரியவர்களுக்கு பண்ணுற மாதிரியே தான் நம்மளும் பண்ணுறோம். பட் பெரும்பாலான குழந்தைகள் வந்து ரொம்ப தீவிர நோயால் பாதிக்கப்படாததுனால பெரும்பாலான குழந்தைகளில் நம்ம ரத்த பரிசோதனை செய்வதற்கான தேவை இருக்கிறது இல்லை. மறுபடியும் இந்த எக்ஸ்ரே அண்ட் சிடி ஸ்கேன், நெஞ்சுக்கு சிடி ஸ்கேன் செய்யறது பற்றியும் தெளிவாக சொன்னாங்க. அதுக்கான அவசியம் அகெயின் பெரும்பாலான குழந்தைகளுக்கு கிடையாது. ஏன்னா அந்த எக்ஸ்ரேவும் சரி சிடி ஸ்கேனும் சரி அதில் வந்து ரேடியேஷன் அப்படின்றது ஒன்று இருக்க தான் செய்யும். ஸோ அதோடைய எக்ஸ்போஷர் பண்ணணுமா வேண்டாமா அப்படின்றத வந்து ஒரு மருத்துவர் அந்த குழந்தையோட கண்டிஷனை தீவிரமாக ஆராய்ஞ்சு அதுக்கப்புறமா தான் அந்த முடிவை வழக்கமாக எடுப்பாங்க. பெரும்பாலான குழந்தைகள் அதுக்கான தேவை இல்லைன்றதுனால நம்ம பண்ணுறதில்ல. ரொம்ப எக்ஸப்ஷனலாக ரொம்ப ஒரு சில குழந்தைகளுக்கு தான் அது மாதிரியான தேவை ஏற்படுது, அவங்களுக்கு மட்டும்தான் நம்ம பண்ணுறோம். இந்த கோவிட் இன்ஃபெக்ஷனை தாண்டி ஒரு சில வாரங்களுக்கு அப்புறமா வரக்கூடிய அந்த MIS-C அப்படின்றத பற்றி மேடம் ஆல்ரெடி நமக்கு சொன்னாங்க. ஸோ அந்த இன்ஃபெக்ஷனில் கோவிட் வந்து போனதுக்கான ஒரு அறிகுறி ரத்தத்தில் சிலது இருக்கும், அதுக்கு ஆன்டிபாடிஸ் அப்படின்னு சொல்லுவாங்க. அது மாதிரியான தருணங்களில் அந்த அந்த கண்டிஷன் எந்த அளவுக்கு தீவிரமாக இருக்குன்றதை பார்க்கறதுக்காகவும் அந்த ஆன்டிபாடிஸ் அப்படின்றது பிளட்டில் இருக்கான்றதை பார்க்கறதுக்காகவும் சில ரத்த பரிசோதனைகள் செய்வதற்கான தேவை ஏற்படலாம். ஸோ இதுதான் ஜென்ரலாக வந்து குழந்தைகளுக்கு நம்ம செய்யக்கூடிய டெஸ்ட்ன்றத மேடம் சொல்கிறது மூலமாக நம்ம புரிஞ்சுக்கிறோம். Okay, so I'll move with the next question, another difficult one, and it's also one of the question from our audience. So I would like Dr. Deepa to share her experience on this. How many parents ask about how they care for their mental health of their children. I mean, imagine confining these kids to their home and depriving them of their entire childhood. They don't even learn how to socialize, and we do come across children who are a bit panicky when they come across strangers nowadays. We have been watching this for the last 6 or 8 months, quite a lot in our outpatient. And traditionally, all pediatricians, we have been advising the parents not to expose these children to screen like a laptop or iPad or televisions or mobiles. But now that the entire education system has switched over to online education, there's hardly an alternative for the parents and for the children and for the teachers and schools as well. So how do you actually strike the balance, and what do you advise them to what do you advise the parents to do at home to support these children?
Again, a very important question, and I think a very relevant question. An interesting online survey that was done showed that 80% of adults that was surveyed had some form of a mental health issue during this pandemic. Either it was anxiety or depression or something or the other, that this pandemic has affected people irrespective of their age. And this mental health issues that are seen with adults is definitely being reflected in children as young as 2 years. So there is data to show that children as young as 2 years are being mentally affected because of this pandemic. Now, it's not surprising that children are being affected because their whole routine has been changed. Children who are going to school are being cooped up inside their house. Children who were taking part in extracurricular activities are unable to do that. They're unable to meet their friends. So there is a lot of things that have changed in the last 1 year, and this definitely is taking a toll in the mental health of children, and it is an important consideration that we need to give. So what can parents do? So the important thing is parents need to be able to talk to the children. So parents need to find time to explain to children about what this pandemic is and how it is going to affect them, how is it going to affect the family, and talk about it in a language that the children can understand. So if you are talking to a 5-year-old, the language that you need to be using should be very different from what you are talking to a 15-year-old. As I said before, the main thing is not to instill fear in a child. It is trying to put the facts on the table, but at the same time doing it in a calm way so that the child you don't increase the anxiety level of the child. So that is extremely important. The other thing is there is a deluge of information coming to the child from different sources, and it is important that parents screen the information that reaches the child. So all the time, if you have 24 hours, if you have your TV running with news about COVID and horrifying pictures about what the pandemic is doing in different parts of the world, and the child is sitting with you and watching this, definitely the child is going to get affected. So it definitely needs to be restricted. You need to restrict what you are watching, and you definitely need to restrict what the child is being exposed to. Conversations around the dinner table also should not be about COVID and what it is doing to families. So the important thing is parents, in spite of the fact that they are stressed out themselves, they need to make the atmosphere calm and happy. So you need to find other things to be talking about across the dinner table, to try and kind of bring the elevate the mood, to lift up the mood and not increase the agitation and increase the tension that children are going through. The other thing that parents can do is, as I said before, find time to do activities, keep the child distracted, don't let the child always be thinking about COVID. So every day have a routine for the child. So children are used to structured routines. They get up in the morning, they have their breakfast, they go to school, they come back, they do their homework. So that is a routine, they're used to that. So parents should have a routine for their children. Maybe they can let them off over the weekend, and allow them to sleep in late, and do things that they want to do. But during the week, they should have a structured routine where the child gets up at a particular time in the morning and has breakfast, and then spends time studying, and then has time for play and things like that. So when there is a structure, the routine to the day, the children also feel more organized. There's less anxiety because they know what they're going to face during the day. So that is something that needs to be done. The other thing that can be done is, if a child was taking music lessons or dancing lessons or something like that before the pandemic, it is a good thing to try to continue that even during this, because nowadays online classes are being offered. So parents should enroll children in these online classes, so that goes without disruption. So these are things that can keep the child occupied and take their mind off this pandemic and what it is doing to children. The other important thing is that children should be allowed to socialize, and for that, and now the only way that they can do that is probably through a video call. So I think parents should connect children to their friends and give them time. If there are adolescents, they should be given time alone where they can spend time talking to their friends, on a video call, so that they can share their anxieties. And there are so many things that adolescents like to share with friends which they do not share with their own parents. So parents shouldn't be there all the time, trying to monitor that. So they should be given some amount of time where they can talk to their parents, to their friends, and express their concerns, and then share things with their friends. So that is something. And children should definitely be allowed to video call with their grandparents, with their cousins, and with their other family members who they probably are not able to see now, especially if they are elderly family members and they haven't seen them for a while. Time should be allotted, every day if possible, or at least once a week over the weekend, where children can socialize with these people. Now, regarding screen time, this is something where pediatricians, we've had to go back in a lot of things that we advised earlier on, because earlier on we used to put down rules saying no screen time for children and things like that. But right now, because of these online classes and everything online, we have had to modify our recommendations. But even now, the recommendation for screen time in children below 2 years is no screen time at all. So children less than 2 years are not allowed to look at any screen, regardless of whether it is an iPhone, an iPad, a tab, a computer, anything of that sort, because there are numerous studies which have shown that children being exposed to screen below the age of 2 years, they tend to have delayed speech, they have delayed social interaction, and a lot of other problems. So these children should not be exposed to any kind of a screen time. When they are being given food, the screen should not be what is used to distract them. Instead, we should go back to our olden days where we used to show them crows and birds and tell them a story, or and distract them and give them the food, and not show them something on the iPhone and on the iPad and distract them and try to feed them. Now, between the ages of 2 years and 5 years, the screen time that is allowed is a maximum of 1 hour a day, and that preferably not at a stretch. If it can be broken up into small segments, the better, but that should be the maximum. Older children, of course, because of their classes and things like that, they probably will have to use more screen time, but it should not affect their normal daily routines, such as their eating habits, their sleep habits, and their other social interaction. So if a child is so engrossed, if an adolescent, a 10-year-old is all the time playing some kind of a video game and is not finding time to eat, is not concerned about his food, is not sleeping enough, is not getting his recommended 8 to 9 hours of sleep a day, and is not interested in talking to anybody else in the family, that definitely is excessive screen time, and that definitely needs to be curbed, because we find that children who are addicted to the screen, to especially adolescents being addicted to screen, they have a lot of problems, especially leading a sedentary lifestyle leads to obesity and a lot of other problems associated with it. And we have found that obese children tend to have poorer outcomes even if they are affected with COVID. So it is all the more reason that we keep children at their ideal weight, weight and height. So it is important that these children do not lead a sedentary lifestyle. They definitely should be allowed to have at least 1 hour of physical activity. It could be exercise or something that they want to do every day, and they should not be addicted to the TV, to some kind of a media. They should not be exposed to violent games that they are playing all the time, and they should not be socializing with people who parents have no idea who they are, because these are things that are high risk, and that should definitely be curbed. So parents should have an eye on what the child is doing when the child is using the computer or anything, even if it is for study. And the other thing that that parents should supervise children, older children, is follow the 20-20-20 rule. For every 20 minutes of screen time that they are using, they should take 20 seconds off and look at an object 20 feet away. So that tends to help in reducing eye strain, because we find children coming with headaches and inability to sleep and things like that after using the screen for prolonged periods of time. And definitely all screens should be stopped at least 1 hour before bedtime, because it has been found that the blue light emanating especially from phones disrupts the sleep cycle, and these children find it difficult to go to sleep. So definitely 1 hour before sleep time, their recommended bedtime, all screens should be switched off. And definitely it should not affect their time that they spend when they're eating. They should not be looking at an iPhone and a tab and having their meals. That should not be happening. And definitely time should be taken for family get-togethers where they spend time talking, where there is no screen. So everybody in the family goes on a fast from screen, and parents definitely need to be role models for this. If parents are using their their mobiles and their tabs and all that continuously and asking their child to stay off it, it's not going to be easy. So parents also should kind of restrict it, and especially during meal times and during the family time together, definitely they should not be using their screens. So these are some of the precautions that parents can take. And especially children who have got special needs, like children who fall into the autistic spectrum disorders. These are the children who are the most affected, being cooped up inside a house, not having any structure to their routine. So when you see signs of aggression or signs of inability to sleep and things like this, when you pick up things like this, it is good to at least have a teleconsultation with your pediatrician or the doctor who's taking care of your child, to discuss options that are available so that things can be controlled early. So these are some of the things that I would recommend. Thank you.
Thanks a lot, madam. So I think IPL nadakra time la ellarku 2020 ellarku theriyum nenikiren. So madam has added one more 20 to that. So 2020 I think is a very useful information for parents to remember. So அவங்க என்ன சொல்ல வராங்கன்னா, 20 நிமிஷத்துக்கு உங்க குழந்தை ஸ்க்ரீனை பார்க்குறாங்கன்னா, அதுக்கப்புறம் 20 செகண்டுக்கு அவங்க வந்து ஸ்க்ரீனை தவிர வேற எங்கேயாவது ஒரு இடத்துல பார்க்க வேண்டியது அவசியம். அவங்க பார்க்கக்கூடிய பொருள் 20 அடி தூரத்தில் இருக்க வேண்டியதும் அவசியம். அந்த 3:20 வந்து நம்ம மறக்கக்கூடாது. அவங்க சொல்றது நேர்கள் ஒருத்தர் வந்து கேள்வியும் கேட்டிருக்காங்க. அதாவது நம்ம கோவிட் பற்றி பேசுறதுனால குழந்தைங்களுக்கு பயம் அதிகமாயிடாதா அப்படின்றது அவங்க கேட்டிருக்காங்க. அதுக்கு ரொம்ப அழகாக ஆல்ரெடி அவங்க விளக்கம் கொடுத்துருக்காங்க. We should remember that knowledge dispels fear. Ignorance aggravates it. ஸோ அறியாமை வந்து பயத்தை தான் விளைவிக்கும். நம்ம அறிஞ்சுக்கிறது என்றைக்குமே பயத்தை போக்குறதுக்கு தான் உபயோகமாக இருக்கும். ஸோ கண்டிப்பாக பேசுங்க. அந்த குழந்தைக்கு எப்படி புரியும் அப்படின்றத புரிஞ்சுக்கிட்டு அதுக்கு தகுந்த மாதிரி நீங்கள் எக்ஸ்பிளைன் பண்ணுங்கள். நீங்கள் பதட்டம் அடையாதீங்க. யூனிசெஃப்லேருந்து வந்து ரொம்ப அழகாக அந்த சைக்கோ சோஷியல் ஹெல்த் ஆஃப் சில்ட்ரன் அப்படின்னு சொல்லிட்டு நீங்கள் கூகுள்லேருந்து நீங்களே டவுன்லோட் பண்ணக்கூடிய ரொம்ப அழகான ஒரு டாக்குமெண்ட் ரிலீஸ் பண்ணியிருக்காங்க. அதில் வந்து படங்களோடைய அழகான விளக்கங்கள் இருக்குது. ஸோ அதையும் நீங்கள் பார்க்கலாம். WHO, யூனிசெஃப் இல்லை இந்திய அரசாங்கம் இல்லை தமிழ்நாட்டு அரசாங்கம் கொடுக்கக்கூடிய மெட்டீரியல்ஸ்லேருந்து உங்களுடைய அறிவை நீங்கள் வளர்த்துக்கிறது எப்போவுமே நல்லது. I'll pass my next question to Dr. Anitha, our intensivist. So, madam, we have heard a little bit here and there about multi-system inflammatory syndrome in children. I mean, even as a doctor, to me, that term is a bit terrifying. It's too long for me to pronounce and understand, to be honest. So I can imagine the confusion and the anxiety among the public when they listen to such terms. Can you put it in simpler terms, like what is this? How does it present? How does a parent recognize it? How do they present to you in the hospital? How do you deal with them? And what is the outcome usually you encounter in these children?
Thank you, Arvind. Agree. Initially, last year, when we first read about it and heard about it, I think UK was the first to report it. Also, then followed closely by reports from the United States and then other parts of the world. So that has given us some knowledge, and because our cases happened a little later, we also saw um, uh, these cases a little later than those countries. So that gave us time to arm ourselves with knowledge and know what to do. Whereas our hospital also had few patients, other hospitals had more numbers in proportion to the pediatric volumes. So this happens about 4 to 6 weeks after the child has been infected with COVID. So that initial infection would not have been detected. It would have been asymptomatic or mildly symptomatic, ruled out as just another viral infection or respiratory infection. Or the child may have been totally asymptomatic also. The only other history we get is one of the family members might have gone through COVID infection. So about 4 to 6 weeks later, this child will present with a different set of symptoms. They may not have any respiratory symptoms. They have fever. So if the fever goes on for more than 3 to 5 days, and they may have some rash, or they may have some stomach pain, vomiting. They can have some redness in the eyes. The lips and tongue may become very red. They may develop some lymph node enlargements. All this put together were seen with another illness called Kawasaki disease. But so it was a little similar to that. So that gave us a clue. And then later, after, so this is the usual pattern of symptoms that we see in children with MIS-C. So the danger is they develop low blood pressure because of certain reasons. The immune system goes into overdrive, so there is an hyperimmune response to the virus. So that makes the fluid leak out of the blood vessels, so the blood pressure becomes low and they can go into shock. So when the blood pressure becomes low, they need to be quickly resuscitated. So which means that we give them fluids through the intravenous route, and also certain other medications to, and maybe even medications to bring their blood pressure up quickly. So all this can be done only in an intensive care unit, and by placing a lot of lines in these children. Um, so once we treat the hypotension, and then the specific treatment is we give intravenous immunoglobulin. This will go and counter the hyperimmune response. We also give them steroids. And some children, older children, depending on some lab investigation and the results that we see, will also need drugs to like anticoagulations that adults during the COVID are being given. So further treatment will be based on a case to case basis, but this is the broad guidelines. So from Chennai, we had a study by two other hospitals together. They had about 60 patients, and of which I think they lost only one child. So with proper management, we do hope that we can save all children and not let any children succumb to this COVID.
Thank you, madam, for simplifying that complex term and the topic. Thanks a lot for that. So, for want of time, I'll just briefly ask a final question to Dr. Nisha. You mentioned that most of the children are quite stable or less symptomatic compared to adults, and so you would prefer to manage them at home. But don't you think the parents would have anxiety about having a child who has known COVID positivity at home and not being a medical person to be able to recognize any early symptoms of worsening? How do you attend to that concerns of those concerns of parents, and how do you actually help them in that regard?
So thanks for that question. So as I said earlier, um, so if a child has symptoms and you suspect it is COVID, and you come to the emergency room, and and your treating doctor will take a look at look at the child and understand how severe it is. Now, if the child has a mild disease and we are planning to send the child home, we often, at every point of time, we send parents home with what medication can be used, what, and especially what they need to look out for as warning signs. Warning signs are things that symptoms and signs in children that we tell parents, if the child has this poor activity, increased cough, increased breathing difficulty, those are examples of warning signs that we tell parents you need to bring the child back at any point of time. And we also give them an emergency contact number, which we call a CUG number, which we have for our MGM Children's. It's carried by a doctor 24/7, so you can contact that number at any point of time. And that is why we have, because of this anxiety, is why we have home care monitoring, where we make video consultations with these children almost every alternate day, to understand how the child is doing. I hope that answers your question.
Yeah. Of course, yeah. I think மேடம் தெளிவாக சொன்னாங்க. அதாவது குழந்தைகளை வந்து மருத்துவமனைக்கு அடிக்கடி கொண்டு வரதை தவிர்க்க வேண்டியது உங்களுக்கும் அவசியம், மற்றவர்களுக்கும் அவசியம். பட் அதே நேரத்தில் அவங்கள வந்து நம்ம வந்து கண்காணிப்புலேருந்தே சுத்தமாக இல்லாமல் விடுறதும் நல்லதில்லை. அதனால நம்ம அதுக்குன்னு சில சிஸ்டமை MGM சில்ட்ரன்ஸ்லேருந்து நம்ம வச்சுருக்கோம். ஆன்லைன் கன்சல்டேஷன்ஸ் மூலமாக பண்ணுறோம். நம்மளுடைய எமர்ஜென்சிக்காக தொடர்பு கொள்ளக்கூடிய அதுக்குன்னு ஒரு பிரத்யேக நம்பர் வச்சிருக்கோம். குழந்தைகள் நல மருத்துவர் 24 மணி நேரமும் இருக்கக்கூடிய அந்த நம்பர் வந்து நம்மளுடைய பேஷண்ட்ஸ்க்கு ஃபாலோ அப்காக நம்ம கொடுக்குறோம். ஸோ இது மூலமா குழந்தைங்களுக்கு ஏதாவது பிரச்சனைகள் ஆரம்ப நிலையில் இருக்கும்போதே நம்மளால கண்டறிஞ்சு அவங்களை வந்து மருத்துவமனைக்கு வர சொல்ல முடியும். இது மூலமா பெற்றவர்களும் அவங்களுடைய குழந்தைகள் வந்து நல்ல விதமா கேர் கொடுக்க முடியுன்ற ஒரு நம்பிக்கையை அவங்களுக்கு எங்களால் கொடுக்க முடியுது. ஸோ தேங்க்ஸ் மேடம், தேங்க்ஸ் ஃபார் தட் எக்ஸ்பிளனேஷன். I would take up a few questions from the audience. I would address one interesting question to Dr. Deepa. How would a parent know the difference between a normal cold and COVID? I mean, காலங்காலமாக நமக்கு வந்து சளி இருமல் வந்துட்டு தான் இருக்குது. இப்போ திடீர்னு 2 வருஷமாக கோவிட்னு சொல்கிறாங்க. இது ரெண்டுத்துக்கு எப்படி வந்து நான் கண்டுபிடிக்கிறது என் குழந்தைக்கு என்ன வந்திருக்குன்னு ஒருத்தர் கேட்டிருக்காங்க.
That is a very pertinent question, but both, the common cold as well as COVID are all viral infections. So by just looking at a child, especially when there is a pandemic going on, it is extremely difficult to say that this child has got COVID and this child has just got a common cold. Now, we are not very aggressive about wanting to know also, because the treatment for both are the same. It's only symptomatic treatment. We would just give paracetamol and plenty of fluids, and we would just monitor the child, and we would just say, take, precautions. That is all we would say. So both the common cold as well as COVID would present with the same symptoms, such as fever, a runny nose, a body ache, maybe a sore throat, and things like that. So the important thing is to, if, especially as I said earlier, any elderly person in the house, any person with a comorbidity, and this child has got this condition which you do not know whether it is COVID or whether it is a common cold, the important thing is to isolate that person till you are sure that this child is not having COVID. Now, if the child is not getting better in about 3 to 4 days, the child, and back to normal, the child is deteriorating, continuing to spike high grade fever, continuing to develop a cough and things like that, that is an indication that you probably need to test the child, so that we know what we are dealing with, so that the adults in the house can take precautions. So initially what we would advise is just symptomatically treat the child, and just keep an eye on the child, and quarantine the adults, especially the high risk adults in the house, so that they are not infected, even in the case that this is COVID. And as we said earlier on also, COVID in children usually goes off as a common cold, a mild infection. It's very rarely that we see children having much more serious infections.
Thanks a lot, madam. That's very clear. Yeah, so there are a few other questions as well. I'd like to take one or two of them myself also, for want of time. So one of the viewers has asked, when will kids start getting vaccinated? If yes, which vaccine is better for them? So, I mean, like with any other medicine or any other treatment modality, kids are always the last to be tested for understandable reasons. So, you don't get to test a new medicine to the kids for the first time without even having any experience about that in adults. So, just continuing with the same logic, we have more literature on how adults are doing with this vaccination. Now, having said that, it's not like we don't know anything about vaccination in kids for COVID, because in the United States, especially, there have been quite a lot of studies based on the vaccines that they use, which is Pfizer and Moderna vaccines, especially in kids belonging to 12 to 15-year age groups. So soon they are beginning to start vaccinating these adolescents in their countries. And UK also has had a positive impact based on their AstraZeneca vaccine. This is actually more relevant to India because we use their AstraZeneca strain to manufacture our vaccine, which is Covishield. So the data on adolescents in this vaccine is pretty much encouraging. So we do expect in the near future we'll get the vaccine for adolescents. Coming to the smaller age group, again in the United States, they've started enrolling children starting from 6 months of age until 12 years, and studies have just kick-started a month ago. So we'll have to wait and watch how good the vaccine does. We are generally concerned about two factors here. One is the efficiency of the vaccine, another is the safety of the vaccine. So we'll have to wait and watch about both these data. Coming to your second question about which vaccine is best, so I wouldn't even think about that at all. As long as the government of India and the state government approves a vaccine for a particular age group, I would rather seize the first available opportunity and get vaccinated, because nobody is going to spend so much resources in getting across a bad thing to the public. So definitely you can trust in the government's advice and get along with the earliest available opportunity to get your child vaccinated, because actually speaking scientifically, if you need data regarding efficiency, you'll have to wait for several years before the data is actually available. Anything else that is being published or spoken about is more an expert opinion or a conjecture. No one can be extremely sure about it, but the underlying basic logic is no protection is definitely much worse than some protection. So I would rather say that children are better with some protection rather than no protection. So there's no point in thinking about which vaccine is better and which should I choose. Should I travel abroad to get their vaccine? I don't think those questions matter much, because any protection is definitely better than no protection. And another viewer has also asked, with these new virus strains, how are the symptoms in children showing? Again, I would rather repeat my previous response to this question as well. The experience with COVID disease per se, especially in children, is still evolving. We are still in the initial early stages of our understanding of the disease. So far what we have seen is that predominantly breathing related problems, that is fever, cough, cold, breathing difficulty, fast breathing. This is what we have been traditionally seeing. But in this second wave, in the last few months, we have been increasingly noticing children who present with stomach related concerns, that is stomach pain, vomiting, loose motions. These are also symptoms of COVID disease that we are noticing. Now, if you ask me, is this because of a different strain? The truth is no one knows for sure, because we are not analyzing the genetic makeup or the genome of every single child that we encounter, or for that matter, not even adults. We are doing only a very sparse sampling of several samples from adults, and they are being sent to referral virology centers. One of them is in Pune as well. So there are very few centers who do this elaborate genomic studies. So again, we still lack enough evidence to comment on the clinical manifestation of different strains of this virus. So I hope that answers the two questions that were posed. Sir, there is another question which I would like you to respond, sir. So one of the viewer is asking, is this a good time to plan their pregnancy?
This is more of a philosophical question, and thank you for that question. The issue is that the coronavirus going to go away? Is the COVID disease something that is going to go away in the next 3 months, 6 months, 1 year? I don't think so. I think it is something that is going to be there for quite a long time, and we'll have to learn what is a new normal and learn to live with it. I wouldn't delay anything for the sake of waiting for the disease and for the virus to go away. I would just get on with life and do whatever is need be for your family.
Great. So I think that's very clear and succinct. Just get along with your life no matter what happens, with sensible decision making. I think that makes a lot of sense. And sir, as a final summing up of things, I would want you to elaborate to the audience, because we do come across a lot of COVID patients who require different levels of care. So in what way do you think MGM Children's is equipped or prepared to deal with the children with varied needs in this COVID pandemic, sir? Can you please throw some light on that, please?
Right. When we're talking about children, we are looking at children in the community, children in the hospital, children who need to come to the hospital. So we need to have an ability to monitor children at home. That is called the home care. We need to have 24/7 emergency room access with trained pediatrician available, which we have in MGM. We have a system of triaging or screening where we can screen patients who are coming with infections which could be possibly related to COVID and separate them and segregate them from children who come for a common thing like a vaccination. That is very important to avoid cross infection. That we have systems in place. We have different specialists who can help children who have got underlying diseases to be taken care of. We have levels of care, general wards. We have intensive care, all levels of specialists available here. So MGM Children's in that sense is very well prepared and ready to take care of children, whatever be the need be, especially from the time of birth, because as I said, we have neonatologists and pediatricians with pediatric intensive care all the way till 18 years of age.
Thank you, sir. Thanks a lot. I hope that was quite useful to the viewers. I would just like to sum up with a few crisp points about what we had learned in the last about an hour. There's no need to panic given the difficult situation that we are in. We just need to adhere to the basic safety protocols. We can get along with our life, of course, in a modified manner, trying to adapt ourselves to the new challenges that we are facing at the moment. But the future is not entirely bleak. Of course, we do have vaccines coming up so rapidly. We do have the situation being put under control by potent authorities, and the healthcare system has also evolved in the last 1.5 years with the experience that we have gained in this pandemic. So we are here to help each other. The medical services are also better prepared now. So the future is not all bleak. So I would say that we approach the challenge with all positivity, like we have done historically in terms of getting the control of plague or smallpox or polio. We have done quite well as a whole, as a humanity. So I think we should have a positive outlook in dealing with that. Added to that, I would just like to make two more points. இப்போ நம்ம இந்த உரையாடலை வந்து எங்களால் முடிஞ்ச அளவுக்கு ஓரளவுக்கு மொழிபெயர்த்து தமிழ்லையும் சொன்னதுக்கு காரணம் தமிழில் பார்க்கக்கூடிய நண்பர்கள் நிறைய பேர் இருப்பீங்கன்றது தான். பட் இதில் வந்து தொழில்நுட்ப சம்பந்தமாக வரக்கூடிய சில விஷயங்களை வந்து அவ்வளவு சரியான முறையில் மொழிபெயர்க்கிறது கடினம். அப்படியே நான் செஞ்சிருந்தாலும் அது ரொம்ப வந்து தியரட்டிக்கலாக பண்ண மாதிரி இருக்கும். அதோடைய அர்த்தம் நிறைய பேருக்கு புரிஞ்சிருக்க வாய்ப்பு இல்லைன்றதுனால எங்களால் முடிஞ்ச அளவுக்கு நாங்கள் பண்ணியிருக்கோம். அதில் ஏதாவது தவறு இருந்தால் மன்னிப்பு கேட்டுக்கிறோம். ரொம்ப ரொம்ப ரெலவெண்ட்டான கேள்விகள் நிறைய எழுப்பியிருந்தீங்க. ஒரு சில கேள்விகளை எங்களால் வந்து உங்களுக்கு பதிலளிக்க முடிஞ்சது, சிலதை எங்களால் பதிலளிக்க முடியல. அதுக்கும் நான் வருத்தத்தை தெரிவிச்சுக்கிறேன் கண்டிப்பாக. அண்ட் இன்னொன்று, நீங்கள் பார்த்துருப்பீங்க, நாங்கள் இவ்வளோ கோவிடை பற்றிலாம் பேசணும், அந்த அட்வைஸ் என்னென்ன ப்ரிகாஷன்ஸ் எல்லாம் சொன்னோம். பட் நாங்கள் யாரும் மாஸ்க் இல்லாமல் உட்காந்துருக்கோன்னு கூட சில பேர் நீங்கள் நினச்சிருக்கலாம். ஸோ அதுக்கான காரணங்கள் என்னன்றது ஒரு சிலதை நான் உங்களுக்கு சொல்ல விரும்புகிறேன். ஒன்று வந்து, உங்களுக்கு இப்போ நம்ம மாஸ்க் போட்டுட்டு பேசும்போது நம்மளுடைய ஐடியாஸ், நம்மளோட ஒப்பீனியன்ஸ், நம்மளோட எக்ஸாக்ட் இன்டென்ஷன் வந்து உங்களுக்கு போய் சேரக்கூடியது ரொம்ப கடினமாக இருக்குது. இது ரொம்ப ஒரு முக்கியமான ஒரு செய்தியாக நம்ம கருதுகிறோம். குழந்தைகளுடைய கோவிட் இருக்கக்கூடிய நிலைமையில குழந்தைகளுடைய கேர் எப்படி இருக்கணுன்றது உங்களுக்கு புரியணுன்றது ரொம்ப அதிக முக்கியம்ன்றது எங்களுடைய கருத்து. அது உங்களுக்கு சரியாக போய் சேரணுன்றதுக்காக எங்களை நாங்கள் வந்து எக்ஸ்போஸ் பண்ணிக்கிட்டு உட்காந்துருக்கோம். அண்ட் ரெண்டாவது, நாங்கள் இங்கே இருக்கிற எல்லா மெடிக்கல் ஹெல்த் கேர் ஒர்க்கர்ஸ் லைக் இன் மெனி அதர் ஹாஸ்பிட்டல்ஸ் நாங்கள் எல்லாருமே 2 டோஸ் ஆஃப் தடுப்பூசி நம்ம போட்டிருக்கோம். அண்டு நம்ம இங்கே இருக்கக்கூடிய இந்த சூழ்நிலை, இது வந்து இன்ஃபெக்ஷன் கண்ட்ரோலுக்கான எல்லா வழிமுறைகளையும் கடைபிடிச்சு ஹேண்ட் சானிடைசேஷன் பண்ணி, இங்கேருந்து நாங்கள் தொடக்கூடிய எல்லா ஆப்ஜெக்ட்ஸுமே நம்ம வந்து சானிடைஸ் பண்ணி வச்சு, இங்கேருந்து போகும்போதும் ஹேண்ட் வாஷ் பண்ணிவிட்டு ப்ராப்பர் எல்லா ப்ரிகாஷன்ஸும் எடுத்துகிட்டு போகக்கூடிய ஒரு சூழ்நிலை நாங்கள் எங்களுக்கு ஏற்படுத்தியிருக்கோம். இது மூலமாக நாங்கள் சொல்ல வராதது என்னன்னாக்கா, நீங்கள் வேக்சின் போட்டுட்டா மாஸ்க் போட வேண்டாம் அப்படின்னு நாங்கள் சொல்லவே இல்லை. கண்டிப்பாக இங்கேருந்து வெளியில் ஸ்டெப் பண்ணும்போது நாங்களும் எங்களோட மாஸ்க்கை கட்டாயம் போட்டிருப்போம். ஸோ அரசாங்கம் உங்களுக்கு எது வரைக்கும் அறிவுரை வழங்குதோ அது வரைக்கும் நீங்கள் இந்த மாஸ்க் உட்பட எல்லா ப்ரிகாஷன்ஸையும் நீங்கள் எடுத்துக்க வேண்டியது ரொம்ப அவசியம்ன்றது என்னுடைய பணிவான வேண்டுகோள். ஸோ இது உங்களுக்கு எல்லாருக்குமே வந்து பயனுள்ளதாக அமைஞ்சிருக்கும். உங்கள் குழந்தைகளுக்கு நீங்கள் இன்னும் பெட்டராக வந்து கேர் கொடுக்க முடியும் இந்த இந்த உரையாடலை வந்து கேட்டதன் மூலமான்னு சொல்லி நாங்கள் நம்புகிறோம். எங்கள் கூட இணைந்திருந்ததுக்கு ரொம்ப நன்றி. தேங்க்ஸ் a lot for all of you for joining this.